So Master Sajjad came to us, with complaints of pain in the left thigh. So upon investigations with X-rays, MRI, and other tests, he was diagnosed to have an well-contained Ewing sarcoma of the left proximal femur. So left proximal femur, the thigh bone, had a bone cancer, which was completely involving the upper 1/3 of the thigh bone on the left side. So when we investigated him further, we found that the tumor has not spread into the muscles. So he was a very good candidate for limb salvage, and moreover, beyond limb salvage, we even tried to did a biological reconstruction where we could save his own femur bone and fixed it, after irradiating it. So he underwent a procedure of biopsy, then neoadjuvant chemotherapy. The chemotherapy was extremely effective in reducing the size of the tumor. So after chemotherapy, we again investigated, got an MRI done, the bone marrow edema reduced, and the tumor was found to be within the bone and had not spread to any of the other organs in the body. So, after discussing with our oncology team and after discussing with the the radiation oncologist, we planned him for a biological reconstruction. That is called as an extracorporeal radiotherapy. So radiation therapy. So what we do is, what we did was, we marked out the size of the tumor, planned exactly how much bone to be removed. Intraoperatively, we removed that segment of bone, and we did take frozen section samples from the proximal and the distal end. What it basically does is gives us a reassurance that there is no leftover tumor. Now that bone was sent for a radiotherapy that is called as the extracorporeal radiotherapy protocol, where a 50 gray radiation was given for 30 minutes. So that basically killed all the bone tumor cells, and that basically helped them to make the bone free of tumor. So once that bone was free of tumor, the bone was washed, cleaned completely of all the muscles, and the bone was put back into the femur in his gap, and that bone was fixed with an intramedullary nail and some plates to give additional stability. Now this basically gives him an opportunity to have his own bone without risks of frequent surgeries, implant failure of any prosthetic implant. So basically there was no artificial implant used here where the joints had to be replaced. There was no joint replacement done. His own bone is preserved for his life, and once his bones get solid, he will be able to walk and run like any other child. He is scheduled for a new adjuvant chemotherapy, which is the chemotherapy given after the surgery, so that the leftover tumor cells, if any, are killed, and there is no chance of any recurrence future in his future life. So this basically gives us an opportunity to do a one-shot surgery for him for life, and there is every chance that the child will never have any problem in future. So this was the case of a biological reconstruction of his left femur bone, and he's recovering well. It's now post-op day 10, and he's happy, smiling, with minimal pain. He's undergoing physiotherapy, he's walking with walker, and that's how fast the children recover after surgery. Thank you.